They had we're meeting here because of the World Donor Day. To meet us, our team is sitting there. Not everyone is here. You're sitting in the area of the donor recruitment, and most of this team.
How much? Sorry? So it's a normal procedure. So it's like your blood goes through a machine, centrifugal machine. It's a 3-hour procedure, and the stem cells are created in the blood inserted in the body.
Is it 1 liter or?
I'm not sure
No,
about
it's not actually even donation. So when you do a blood donation, for example, you donate around 350 to 400 ml of blood when you do a simple blood donation. Okay. But here, what happens is that you increase the number of stem cells in the blood. For example, I just give a crude example. When in normal people like us, our white cell count is like 4,000 to 10,000. When you give growth factor, it goes to 30-40,000. So you're basically, bone marrow is making extra stem cells, and it's going into the blood. And those extra stem cells you're collecting. And the volume which is collected is actually very small. It's from 150 to 250 ml. And that's actually not blood, it's the extra stem cells you have generated, and those are being collected in the machine. So it's even the loss, so-called loss from the body, is even less than what a normal blood transfusion, what blood donation you go through. So it's that way you don't lose anything. Actually you have got more stem cells for few days even after the procedure.
Sir, who are eligible for this?
So it's because the unrelated donor transplant, that means they're not related to the patient, so it has to be adult. Adult means they have to consent for the procedure. Adult means 18 and above in our country. So they have to be above 18. But not in this context, which is unrelated donor context, but in a related donor context. That means if your relation is donating, there is no age limit. If you see, I have taken 5-month-old baby's stem cells have been taken to give for his sibling. So when you're talking about family donors, there is no age limit. But for this unrelated donor process, there's an age limit. It's 18 years and above because they have to be adults. The higher age limit, which is up to what age you can donate, that depends on different registries of different countries. Some have 50, some have 55 years. But lower is 18. You have to be an adult to be able to donate. 18 to 55, 18 to 50. What is your here BKMS? 50. So 18 to 50 in BKMS. These are the unrelated donors, but related donors, any age you can donate, not a problem.
Are there any risk in this?
So these people can donate, can answer that question. So how difficult was it? How risky was it?
Yeah, and what were the side effects during the procedure?
I'm sorry, we appreciate all the questions. Can we please have, so we're going to have a Q&A session right after this. So can you please hold on to the questions until then? Thank you so much. Last but not least, we have Devraj, 39-year-old senior techie from Bangalore. So, Devraj, out of the 40 million stem cell donors registered in the world, only 5 lakh of them are from India. What would you want to say to people to motivate them to come out and register?
First of all, thank you everyone that BKMS is organizing this conclave. My journey started in 2018 when I was working for a fintech company, and BKMS came into our campus, and I was just going out for lunch, and that day I had to travel for work as well. So one of my friends pulled me in and said that there is one organization which has come, and why you register here. So that's the first time I came to know about this kind of an initiative. Frankly speaking, I know about stem cell because when my first kid was born in 2011, that time that cord cell, I think that stem cell, that initiative was also gaining kind of a momentum, and I registered for that. So I know that what stem cell does and what it can do to support a life. So I went ahead and registered, but I never knew that maybe I can get a call one day. So I got a call around January 2022 this year, and after that my procedure happened in April. So basically what I want to say is that awareness is the key. A lot of people don't know about this particular deed, and generally the more is spread because whenever I got after my I did the donation almost 4 to 5 calls from my friends, as well as when I shared my story with the couple of folks. I wrote a blog as well, and that blog was also circulated. I also wrote something on LinkedIn, my personal network, in the professional network, and people also poured in with a lot of their comments, and that's how you spread the news, and that's how I think media houses has a very important role to play here because they can reach to wider audience. And India is, as you know, is a large populous country. We have a sizable amount of young population, so if we can rope the young healthy adults, I think it means we can serve a lot of the people worldwide. Because the patient to whom I served, I came to know that he was in Portugal, and that was a 14-year-old boy who was suffering from blood cancer. So that's what I came to know. So this kind of thing, and I was very happy. Initially there was apprehensions, of course. My family was a bit worried. My wife was saying that since it is a 5-day procedure, but Chandrasekhar was there. He helped me out in each and every procedure. He told me that I can consult with the doctor. I went ahead, I consulted with the doctor. It was a very clear procedure. After that, they moved me to a hotel here, means nearby, and we did all the procedures. It was a 3 years procedure, very simple, straightforward, but only thing is that you have to lay in a bed, that doctor was saying earlier.